My name is Matt Campbell. I am a associate professor of genitourinary medical oncology at MD Anderson Cancer Center in Houston, Texas. My passions are kidney cancer, adrenal cancer, and trying to really understand how kidney cancer grows in bone metastasis. And it's an honor to be here today to talk with you. So this was a project that started in terms of my involvement in 2013. And I actually applied for this grant twice. The first year I did not get it, the second year I did. And so the work was building on work from Dr. Jim Allison, who had, in his modeling of prostate cancer, had shown that when a CTLA-4 drug was partnered with cryoablation, it was much more effective than when CTLA-4 was given alone or cryoablation was done alone. And so that led to a study that was led by Pam Sharma in my group and Srena Mateen at MD Anderson. And so the entire concept was we were going to use a drug called tremelimumab, which was CTLA-4, and we were going to use cryoablation, meaning freezing tumors as a way of killing them, to see if we could enhance immunotherapy's effectiveness in treating metastatic kidney cancer. So my involvement was doing the correlative studies, so all of the tissue that was collected at biopsy and at either surgery or repeat biopsy, and the blood that was collected so that we could test these samples. And so the grant that we proposed was perfect for my career development because I'm passionate about patient care, passionate about clinical trials, and this allowed me to really learn under the guidance of Pam Sharma, Srena Mateen, on how to write a study, how to do the correlative analysis, and then how to publish the study once it was all done and present that work. And so we were able to successfully publish that in Nature Communications in 2021. It also taught me how long investigator-initiated studies often take, but they're very worthwhile because I think we learn a tremendous amount when we do these deep dives into the biology behind the treatments that we're given. And so what it did for me, it served as a major springboard for designing additional investigator-initiated studies, understanding how to partner with some outstanding basic science laboratories that are invested in immunobiology as well as now bone biology, and trying to really understand how the immune system is interacting within the bone microenvironment for patients with metastatic kidney cancer. So that's, I think it served as a perfect opportunity to give me confidence in grant writing, give me an opportunity to really do a deep dive, and then have the reward of hard work and actually seeing a project to the finish line. And so I'm very grateful to the Kidney Cancer Association for giving me that opportunity. And so for me, my connection to the KCA came through Dr. Nizar Tanir and Chris Wood on the medical oncology and the urology side. And so both of them introduced me to the fact that, this is an incredible organization focused on kidney cancer, and they're very interested in supporting young researchers. And I think having that mentorship of where to reach out, how to interact with these associations is very critical in our early development because it gives us an opportunity to shine early, whereas it often can come later if you're not invested in these types of groups. So I kind of think about kidney cancer from milestones in my own lifetime. And so when I graduated from college, which was in 2003, we had cytokine-based treatment. And that was all that we had for treatment of metastatic kidney cancer. And then when I think about when I graduated from medical school, which was in 2007, we started to have the targeted therapies come along. And then when I think about when I graduated from fellowship, which was in 2015, having worked with Nizar Tanir, we were starting to begin to have immunotherapy emerge. And then we also started to have very effective additional targeted therapies emerge. And then during my early portion of my career, we didn't have any immunotherapy frontline options, and all of those have come in the last 9 years of me being on faculty. So the pace that we have made these changes has been staggering. And my feeling is that we are just kind of unlocking the surface of potential for immunotherapy strategies and other better ways to target this cancer, and really try to hone in on the different rare subtypes as well. And my colleague Pavlos Masal is doing tremendous work in some of the very rare aggressive subtypes, and there's many talented people in the field right now that are extremely passionate about working on kidney cancer. And I think with that passion, with now the clear interest in drug development in kidney cancer, there's tremendous hope that we're just going to get better and better at treating this cancer over the next 5 years, 10 years. And my hope is very much that we're going to cure more and more patients with metastatic cancer in the coming time period.